Skin+Bone was born out of the understanding that healthcare is expensive for patients and for the government to provide quality healthcare. It's getting more subspecialised and there are few specialists for the growing number of the population. We understand that getting to the right expertise at the right time can reduce the cost to the patient, to the system, and can get people better quicker. And we felt that in the private system, there was no way to coordinate that rather than end up in an emergency department and a physical space where all the specialists were located in the right space at the right time. With the population being spread out over a wide geographic area, Victoria being one of the smaller states, we know that patients have to travel to get to the right expertise, to a physical emergency department, and we felt that there's a better way to do that, a quicker way to do that, and a more convenient way to do that for patients that improved their recovery, both in terms of the patient experience as well as the quality of their outcomes. There's been lots of research that shows that where you live determines what specialists you have access to, how quickly you can get in to see them, and the cost of accessing that care. And sometimes, especially in this era of increasing subspecialisation, people that you normally encounter within the community, GPs, emergency departments, don't know what expertise is required for that particular injury or condition. So often in the elite sporting world, we have access to sports physicians, pain specialists, psychologists, orthopedic surgeons of varying different specializations who know where they can access that expertise within the team. What we at Skin+Bone are trying to do is expand that network and provide that access to the community that is currently offered only in the elite sporting environment. Yeah, certainly for the elite professional athlete, time is money. The delays in trying to get to the right person, know what scan to get, know what the problem is before they can start on a treatment recovery plan is all time. Time that they're out of the game, time that they're not earning money, time that their team is losing their key asset. And for us individuals in the community, it is equally a cost when you are injured, a cost that to your family, to your club or your team, a sporting team that you're a part of, and time off work potentially, that you are not able to function in your normal productive way. So trying to reduce the time to get a scan if you need it, to get the right advice so you know what your injury is, and then start your recovery so that you can start getting better sooner is what we're trying to do at Skin+Bone. As practitioners, we are a team of specialists, and that includes radiologists with access to the right scans, the reporting ability to differentiate difficult problems sometimes. So that's radiology services, sports physicians who are often treating elite athletes in the professional sporting codes, allied health professionals who again are supporting these professional teams and clubs, as well as orthopedic surgeons and plastic surgeons, and giving and curating a wide network of expertise and providing access to you in the community to these individuals. And not every injury requires surgery, not every individual requires, with an injury requires an MRI scan, for example, but it's understanding the information from you, your individual situation, your specific injury, and then matching you to the right expertise. And we can find that in our network because I've handpicked them. It is hard to quantify that because a lot of injuries do get better with time. A lot of injuries do get better with community treatments, trying, without necessarily knowing what the diagnosis is, but trying different types of physical therapies and not needing to see a specialist. But having that right information early can help filter that to seeing if you can wait and see if time makes this injury better, or seeing your local physiotherapist to try a few different treatments to make things better, or whether this falls into the category of you need to know now, otherwise your outcome is going to be quite vastly different if a certain diagnosis is made, which ordinarily may have been missed if you let it go 2 or 3 weeks. That can mean the difference. For example, just a sprained finger. It might seem as if it's just a jarred finger. And I saw a patient just the other day who was playing in regional Victoria. Finger, thought it continued playing, just thought he had jarred it just like every other finger injury, but felt that it was popping out a few more times than usual. Didn't want to miss the season, strapped it up, couldn't get in to see a specialist because it was in a regional area and there's high demand for a low supply of specialists in the area, and continued to play out the season. Now it is 10 months from the original injury and he's got a severe finger injury that is going to take him out for this whole season. Now, is that a problem with not knowing that the injury was severe, not having access to a specialist, or just not having the means to access the right care locally? So this is what our service is trying to provide. If it doesn't feel right and it doesn't get better within a certain time frame, this gives you the ability to access the right knowledge and advice to give you a diagnosis and give you a treatment plan that can be delivered locally with our extensive network, so that you don't have to wait 12 months with repeated injury, your injury getting worse, and then potentially having a much bigger treatment requirement, and in this case, extensive surgery, long recovery times, whereas a simple splint early in the piece could have made all the difference. Certainly, the GP is an important member of managing the health and well-being of individuals in the community. That is their role. They play an important part to understanding the healthcare system and being a gateway to accessing the right parts of the healthcare system and providing a longitudinal relationship to manage people and their injuries and their well-being in general. Sometimes there is inadvertently a delay in accessing GPs. That's when patients, often with an acute injury, end up in the emergency department. And fortunately, there's been an expansion of emergency services with the development of urgent care services. And these are all different ways in which you can access timely care when you need it quickly. Skin+Bone certainly recognizes all these different services, but tries to provide specialist advice early in the piece if those services need extra support from specialists, or if you can't access those services in the timeframes that you need, or if you're living in an area where you don't have those services available. So regional and rural patients, patients that potentially have dependents where they can't get along to those services and sit in the emergency department for 4 or 5 hours, or just can't get in to see their GP for whatever reason because of work commitments or caring commitments. This provides a hybrid service, so virtual advice from your own home. You can upload all your information, including photographs of your injury, what has been done so far, whether you've strapped it, taped it, got some scans partway down the journey, not at all down the journey. We can pick up and support you in getting the advice by giving you those extra referrals, advice, which can be supported with over the phone, and then in person, a concierge type service where we recognize the right specialist, local to where you live, at a time that's convenient for you to then pick up and continue your recovery or assessment and treatment within 2 or 3 days. The advice will come to you within 24 hours. You'll see a specialist to start your recovery process within 48 to 72 hours, and that means that you can confidently move forward with your recovery and hopefully minimize the amount of time and disruption to getting back to work, to getting back to life, to getting back to sport.